refer to the government's expansion of Medicare telehealth rebates to some patients and services. Will the government expand telehealth rebates to all patients and services so that Australians don't have to visit a health provider during this crisis when it's not absolutely necessary? In particular, will the Prime Minister agree to expand telehealth rebates to mental health services and also provide mental health screening to people affected by COVID-19 and ensure dedicated services for children, parents and health workers?
The Minister for Health.
Thank you very much, Mr Speaker, and I want to thank the opposition spokesperson for this question. And the answer is yes, we will be taking those steps. We have shortly before question time announced the third stage of our telehealth expansion. The first stage of telehealth expansion was announced with the initial package of activities with regards to the $2.4 billion of health activities, and that in particular provided telehealth to those who were in isolation or seeking diagnosis for coronavirus, but also to vulnerable groups who were not within those areas. The second stage, which was commenced on March the 16th, was an expansion of telehealth items for midwives and recognises a general practice for continuity of care practices, which meant a broader access for people who were otherwise vulnerable. And then today, in a joint statement with the Royal Australian College of General Practitioners and the Australian Medical Association, but also worked in conjunction with the Australian College of Rural Medicine, ACRM, and the RDAA, the Rural Doctors Association of Australia. We announced a further expansion of telehealth. That expansion of telehealth now allows all doctors and medical practitioners who are vulnerable to be able to practice from home. As part of that, we have announced that we will be moving to and designing a Stage 4. The medical practitioners were very, very, very clear that they wanted to design this carefully and in a staged capacity. That Stage 4 is a whole-of-population access to telehealth. The reason it's being done in a staged capacity is twofold. One is there is a very important need to maintain face-to-face services, whether it is for conditions which might be cardiac, whether it is for conditions which might involve musculoskeletal challenges, whether it's for conditions which might involve diagnoses through the ability to actually test and feel and see a patient's condition. All of these were identified by the medical practitioners as a critical step forward. But that face-to-face is Stage 4 for the whole of population. That telehealth for the whole of population is now being designed in conjunction with those groups I've just outlined. It's being led by Professor Michael Kidd, who's working with the government. We have now had over 100,000 telehealth services provided, and they are continuing at well over 20,000 a day. And Stage 4 will allow that to be provided on a whole-of-population basis. The other thing we wanted to do is make sure that smaller general practices were protected, which was a specific request. All of these elements are part of the current design.
And the member for McMahon, just on indulgence.
Thank you. On indulgence, Mr Speaker, can I thank the Minister for his answer and acknowledge the announcement that he's made? It was a suggestion made by the opposition in good faith. We are very pleased that the Minister has taken it up. It's been based on very strong feedback from GPs and allied healthcare professionals, and also in relation to mental health. I completely understand the government's focus on physical health, but we all need to collectively turn our attention and we all need to turn our attention to the mental health of Australians as we get through this crisis. I thank the Minister for his response.